Hey everyone, I'm Ashleigh Banfield and this is Drop Dead Serious. I can't believe how many people are completely polarized on the question of Lindsay Clancy. And I can't believe how many people keep asking me about her. I get it, I cover true crime, right? That's what I do, why you're here. But it's so weird. Like, I'll be out on the boat visiting some friends. I'm like, what's up with that Lindsay Clancy? And I'm going to tell you right now, it seems to me that more women than men feel very sad for her. They feel she's been failed. And the older the folks are who talk to me, women or men, also feel sympathy for her. I have definitely run into a few who say, string her up. Fewer though. And I have really noticed the difference between a quarter century ago when I covered Andrea Yates and everybody lost their minds, right? Understandably, she drowned 5 of her children face up in the bathtub, one after the other, starting from the youngest to the oldest. So the oldest knew what was going on and was running for his life. It was horrifying. And in that trial, way more split, way more people had zero sympathy for her. In fact, her first jury convicted her, right? Second jury suggested she was not guilty by reason of insanity. Let's not talk about her for a moment. Let's talk about the 25 years since and Lindsay Clancy. Because as we get more details about this case, it's starting to make a little bit more sense just in terms of what the jury has to focus on. They can't just go in there and give their opinion of how they feel about this crime. They are instructed to stick with, and by the way, there's a plane overhead. This is what I live with normally. Float planes going over all the time, so I hope you're okay with that. If you don't know this already, I'm on an island in Canada. And so it's very rural. I get everywhere by boat, and the float planes are always overhead. So it is very granular what this jury has to look at in terms of what the core questions are. Insanity is a very specific thing in a courtroom. And you have to prove she did not know right from wrong. She couldn't appreciate the nature and consequences of her actions. And her postpartum psychosis was the reason for it. So how do you get there? How do you give a litmus test, a blood test, so to speak, for that kind of illness? You don't. You get the medical experts up there. And some of the medical professionals who treated Lindsay Clancy in just the few months before she killed her 3 little kids, they made their appearance. They took the stand. They said under oath, they'll tell the truth, the whole truth, nothing but the truth. And what they said, honest to God, cuts both ways. And I will be so interested to see what you think about what they said. In the comments, make sure you let me know and why you think what you think. I would love to know what your demographic is too, because I think that is fascinating as well. We're talking about 3 babies. Cora Clancy was 5. Dawson Clancy was 3. And little baby Callan Clancy had not even reached his first birthday. He was only 8 months old. And make no mistake, those 3 babies died a horrifying death at the hands of the one person they were meant to trust the most in their life, their mother. I don't know what happened in that basement, moment to moment. I just know that she used those exercise bands to strangle each one of them. And that had to happen one after the other, right? I don't know if she went from youngest to oldest, oldest to youngest. I don't know. It's a horror, no matter how you look at it. And there is the emotion that no one can get out of their gut. When they talk about this case, weigh in on this case, decide on this case, or if they are jurors in this case, because those photos have been flashed all over this courtroom and no one can forget what's really at stake here. Babies. Babies who should never, ever have seen or gone through what they went through. So I will say this. So far in the case, not one of the medical professionals said that they believed that Lindsay Clancy was psychotic. But they did say they were treating a woman who could not sleep, who repeatedly changed her medications, and was sending increasingly alarming messages, emails, communications about whether she could even keep going. I have a lot of problems. As I lay all this out for you, I have a lot of problems with the things that she was saying versus how the doctors were receiving it. Because like I said, there's no blood test for this. And so I don't know how they make their decisions. I don't know how the medical community individually makes each decision about each of these patients and what the patient is telling them and how effing dire it is, or, okay, it looks like you're A, B, or C, just like all my other patients. That's what you're going to get in the next few minutes as I tell you this stuff. And I really want you to think about what she's saying versus what they're hearing, how they're classifying her, because I am struggling with it. I am upset about it. Her attorneys say that Lindsay was profoundly mentally ill, over-medicated, and psychotic. The prosecutors said, no, she was anxious, she was depressed, she was struggling to sleep, but that she remained clear-minded and she showed no signs of psychosis or mania, and that she understood exactly what she was doing. Holy shit. How do these people see it so differently? How are we all seeing it so differently? Lindsay was prescribed roughly a dozen different psychiatric medications, all between the fall of 2022 and January of 2023. And that is a regimen that her attorney, a guy named Kevin Reddington, has described in court as a, quote, cocktail of drugs. Cocktail. I think it's more like a shot ski. I mean, I have a cocktail. This just looks like it's, a frat party of psychiatric medications. But the dosages of all of those medications are what's key here. Like, I don't know if you have ever had coconut rum. It doesn't have the power that regular rum does. And so if you have one of those coconut rum drinks, it's not as strong as if you have a regular rum drink. So you can count the number of drinks, but it's the dose of what's going on that's key here. Her providers repeatedly testified that many of those prescriptions began at the lowest possible starting dose. That's important. You ever had that? Your doctor says, I'm going to start you on this. We're going to work you up to the level where it'll actually, affect you, but we need to make sure you're okay getting there. Might not even see any difference at the beginning, but then their position was that Lindsay was not being overwhelmed by dangerously high doses. The prosecutors say, no, she started low, but that she frequently became afraid by the possible side effects that she was having, and that she wanted to stop these medications or switch these medications before they even got to the dose where they would actually work. Like, it was all happening in that ramping up to the dose that she needed, all the shitstorm, right? I don't like this. It's making me feel awful. I can't sleep. I'm terrified. I need to change. The jurors, they've got a huge task in front of them. Yeah, they got to consider, was Lindsay dangerously over-medicated? Did her doctors miss the warning signs of something far more serious, like a psychiatric disorder? Or were her providers working with a patient who was actively involved in her own care and appeared rational, never showed them any sign that she was psychotic or, God forbid, capable of killing her 3 babies? So in a moment, I am going to talk to somebody who has truly made this make so much sense for me. All of the jumbled testimony, the medical testimony, the medications, the mania, psychosis, depression, all these terms and why they matter, and where they actually fall when it comes to the ultimate question that the jury has to answer. And that is, does she reach the level of insanity? Like, all these illnesses that you're throwing out and the meds, how do we figure that one out, right? And so Dr. Stacy Cohen is about to talk to me about all of this. And did I ever hit the right guest? Because she specializes in women's health. She was chief of women's health at the Rush University Medical Center in Chicago. She's board certified in general psychiatry and addiction psychiatry. Very important because we're talking about meds, and meds are a huge part of this story. She also runs a practice called The Moment. Oh, look it up. She focuses a lot on peripartum psychiatry, which is basically what this case is all about. So please do not miss this conversation with Dr. Stacy Cohen. I also just really like her a lot. She's very cool. But for a minute, let's talk about Lindsay's doctors, because I want to begin with one of them. Her name is Dr. Jennifer Tufts. She was Lindsay's primary psychiatrist. Dr. Tufts began treating Lindsay on September 15th, 2022. That's about 4 months after she gave birth to her littlest one, Callan. It's also 8 months before all hell broke loose and those 3 kids were killed. So Dr. Tufts said that Lindsay was struggling with anxiety and insomnia, and Dr. Tufts diagnosed her with generalized anxiety disorder and adjustment disorder with depressed mood. It's a lot. That's a lot. She testified that she prescribed Lindsay 25 milligrams of sertraline. It's better known as Zoloft. We all know that. We've heard of Zoloft. According to Tufts, Dr. Tufts, that was the very lowest dose that you start on, right? And the plan was for Lindsay to take 25 milligrams for 1 week and then increase it to 50 milligrams the next week. But she said that Lindsay was deeply apprehensive about this medication and the potential side effects of it. And at their next appointment on September 28th, Lindsay admitted that she had picked up the Zoloft, but had not taken it. Ugh. By October 20th, she told Dr. Tufts that she had finally started the Zoloft about a week earlier. But when she increased the dose to 50 milligrams, as she was instructed, as was the plan, Lindsay said that she experienced some pretty negative side effects. And Dr. Tufts said that she told Lindsay to stop taking it. Okay. Did everything the doctor told her. The next day, October 21, Dr. Tufts prescribed 0.5 milligram of lorazepam, also known as Ativan. It's a benzodiazepine, and it is to be taken only as needed for severe anxiety. Oh, and by the way, benzos, you hear doctors talk about benzos all the time. That's dangerous stuff. It can be very addictive. A lot of people get into lots of trouble on benzos. And so Dr. Tufts said that she described what she prescribed to Lindsay as a low dose of benzodiazepine. 5 days later, Lindsay said the Ativan definitely did help her anxiety, but it did not help her to sleep. And she was also using Benadryl as a sleep aid. This was a big thing for Lindsay Clancy. She was struggling to sleep, losing sleep all the time. And as we all know, that's super dangerous and it can exacerbate any kind of condition that you have. So Dr. Tufts then prescribed Lindsay 5 milligrams of buspirone. She was supposed to take it twice a day for anxiety. She also gave her 25 milligrams of hydroxyzine, an antihistamine with effects that are similar to Benadryl. And once again, Dr. Tufts testified that she started the doses low. And Dr. Tufts said that Lindsay was also concerned about becoming dependent on the Ativan. That makes sense. She probably did some reading. Benzos are dangerous. You could become dependent. And so Tufts did not intend for her to use it long term. And they started to talk about all the alternatives, right? And over the next several months, Dr. Tufts continued trying to find some kind of a combination of meds that would help control Lindsay's anxiety, her depression, and her relentless insomnia. In total, wait for it, she treated Lindsay 14 times between September of 2022 and January of 2023. So September, October, November, December, boink, January, 4 months plus. Okay, all through telemedicine, which were online appointments. Dr. Tufts never once saw Lindsay in person. That's interesting. Look, I'm a person who appears on camera all the time, and I can tell you, I don't think you know everything about me. It's really one-dimensional, right? Seeing somebody in person, there's a lot of cues, there's a lot of body language that you won't see on a telemed appointment. And I'm not dissing telemeds. I think it's great. It's so much more access to medicine that people weren't doing before. But come on, 14 times? I think you need to come in and see me. I think we need to talk in person. I mean, that's something I would do. I'm not a doctor, but that's what I would do. But Dr. Tufts never treated Lindsay in person. And when she walked into court to testify at Lindsay's murder trial, it was actually the very first time she'd ever been in the same room as Lindsay Clancy. I think that's a big conversation for doctors now. I think doctors need to discuss, when do you stop the video calls and say it's time to do in person or this isn't working? I think it's huge. Body language is huge. It's why we see someone in court. We don't see them on a TV screen. We see them. We see their body language. We see everything they do when they sit on the stand. And we have our instincts. We know when someone isn't telling us the truth. How? How do we know that? It's called your gut, and it's fed by body language. So Lindsay's defense attorney, Kevin Reddington, pushed some buttons, right? Pressed her really hard on whether those virtual appointments limited this doctor's full ability to evaluate a postpartum patient whose mental health was like falling off a cliff. And Dr. Tufts acknowledged that she did rely almost entirely on what Lindsay told her for all of those assessments. Self-reporting. She never spoke with Lindsay's parents. And she only spoke with Lindsay's husband, Patrick Clancy, during one session in December. And in December, Lindsay told Dr. Tufts that she was experiencing intrusive thoughts, that she felt hopeless, and that she felt, quote, close to having suicidal thoughts. During this period, Lindsay was evaluated at Massachusetts General Hospital for suicidal thoughts and was also admitted to McLean Hospital, a psychiatric facility. But according to Dr. Tufts, Lindsay never displayed any signs of mania or psychosis during any of their 14 appointments on video. Kevin Reddington also attacked Dr. Tufts' experience, because that's what you do, right? And I feel for people who take the stand, because the cross-examination is always going to be somewhat blistering. They're going to go after what you say. They're also going to go after who you are and what your quality is in terms of the value of what you're saying, right? Like, are you a dope? Are you worth your weight in salt? Should everybody take you as seriously as they're taking you just because you have doctor in front of your name? Or are you maybe not everything that you should be? That's the way this works in a courtroom. And so that's what the defense is going to do. They're going to attack this doctor and her capabilities and her ability and her experience. And when this doctor first treated Lindsay, Dr. Tufts had been working as an independently practicing psychiatrist for approximately, you ready? 1 month. She'd been working in that capacity for 1 month. She graduated from medical school in 2018. She completed her psychiatric residency in 2022, and she began working at Astor Mental Health in August of that year. And she saw Lindsay for the first time the next month in September. So yeah, new doctor. That doesn't mean that she's not good. There are plenty of new doctors who are better than a lot of the older doctors, but it is something that the jury can take into consideration. Was she maybe a bit inexperienced? It's a question. So Lindsay's defense attorney then questioned why Astor Mental Health's website listed perinatal psychiatry as one of Tufts' areas of expertise. And the jury also learned that Lindsay had called a suicide crisis hotline not once, but twice. And here's what really pisses me off. She was reportedly turned away, apparently because she didn't have an actual plan to kill herself. I didn't know that happened. Like, you call a suicide prevention hotline, and it's like, unless you have some concrete plan, no time for you. Maybe they're overwhelmed. Maybe they're in triage, and they're dealing with the people who are most, acutely at risk. Lindsay got turned away. Dr. Tufts testified that she knew nothing about either of those phone calls. Well, that's fair. And when Lindsay's defense lawyer asked whether that surprised Dr. Tufts, the doctor on the stand said, yes, it would surprise me. Quote, it would surprise me. Surprises me. I don't know much about suicide prevention hotlines, but hearing someone get turned away is that's very upsetting. But Dr. Tufts wasn't the only doctor who was treating Lindsay during this period, not the only provider. Rebecca Jolada, a psychiatric nurse practitioner with South Shore Hospital's perinatal behavioral health program, also began treating Lindsay in November of 2022. So that would be 2 months after Lindsay started seeing Dr. Tufts. And Jolada believed that Lindsay was experiencing postpartum depression, along with anxiety and severe sleep deprivation. But her testimony revealed that she also considered whether Lindsay's reaction to her medication and her inability to sleep could indicate an underlying condition of bipolar disorder. Okay, now we're getting into the big serious stuff, right? And during an in-person appointment, not telemed, this is in-person, this one happened on December 6th, Lindsay told this nurse practitioner, after taking Zoloft, she remained awake for 48 hours straight. That is a lot. I know it doesn't sound like a lot, but you try it. Yeah, 24 hours is bad. 48 is brutal. Don't forget, you got 3 babies. And Ms. Gelada called that reaction very unusual. She used the words unusual. She said it raised the possibility that Lindsay could be experiencing a mixed manic or hypomanic state, meaning she could have symptoms of mania, including the lack of sleep. At the same time, she was experiencing severe depression. It's a lot of gobbledygook to me. It sounds like just a whole lot of bad shit all happening to this poor woman who's just struggling to figure it out, begging for help. And Ms. Gelada discussed that possibility that she had that combo with Lindsay, but also with Lindsay's husband, Patrick Clancy. And she remembers Patrick responding, and this is the quote that she gave on the stand. She says the husband said, quote, "My wife is not bipolar." Patrick Clancy, she said, "My wife is not bipolar." And Ms. Gelada testified that by that following week, Lindsay had returned to a more regular sleep schedule, but said that she still felt hopeless and emotionally numb. She described how Lindsay frequently sent her messages through the portal. You know those portals that you use for medication? You're not supposed to email. It's not secure. So now you can message through a portal. She said she got a lot of those messages from Lindsay through the portal, asking to change the meds, right? Sometimes only days after starting the meds, because Lindsay said that these meds were causing her intrusive thoughts and causing insomnia and causing her emotional numbness. These were all the things that Lindsay was saying. But Ms. Gelada said she believed those symptoms were more likely caused by Lindsay's underlying illness. And I'm like, okay, I don't give a flying F why. I don't care if it was underlying, overlying, or all mixed in between. If there were all these illnesses, doesn't this matter to the ultimate effect and what happened? Ms. Gelada wrote back to Lindsay and said, quote, "All of this sounds like postpartum depression, period." Look, I'm a layperson, but my response to that is, duh. You know, yeah, she's got postpartum depression in some way. She's melting, you know? Ms. Gelada testified that she repeatedly explained to Lindsay that psychiatric medications often take several weeks to become effective, but Lindsay was still terrified of what those meds might actually do to her. You know, Lindsay wrote back the following: "It is just a scary, very scary, stressful time for me. And starting new meds with side effects is very scary to me." That's important to me because it says to me that Lindsay is afraid of what these meds might make her be or do or become. Her concern is like, I don't want to do something that causes hell and high water. Ms. Gelada said she tried to reassure Lindsay and sent her detailed answers to the common questions that patients have about medications. And interestingly, she said that Lindsay appeared to recognize that constantly changing providers and medications could be contributing to her problem. And she testified the following. She said, quote, "I think it's my problem." This is what Ms. Gelada testified Lindsay said to her. Quote, "Lindsay, I think it's my problem. I keep reaching out to different people and not sticking with the plan." End quote. By December 1st, Lindsay was writing messages that were far more disturbing. Let me read this one. It says, "Sorry for all the messages. This is just a scary time for me," Lindsay wrote. And in another message, she said, quote, "I am willing to try anything," end quote. And then she wrote this: "I also just feel concerningly numb right now, like I have no emotion whatsoever. I feel like I'm going to die and I don't care. What do I do about all of this?" Wow. Okay, red flag for me. I'm not a medical professional, like I said, but that stands out. Ms. Gelada said she believed that Lindsay's emotional numbness was a symptom of depression, and so she provided crisis resources, but did not tell her to go immediately to the emergency room. Remember, she's got 3 little kids at home under the age of 5. I feel like I'm going to die and I don't care. What do I do about this? Let's face it, I cover some of the darkest crimes out there, but let me tell you, some of the scariest stuff is happening quietly right behind your screen. Your name and phone number and address all floating out there online, and it ain't because you gave it away. It's because somebody sold it. Data brokers, they're tracking you. They know what you buy, what you search, what meds you take, even where your kids go to school. It's chilling, but what most people don't know is that you actually have the legal right to make the data brokers delete your info. Trouble is, doing it yourself could take years, and that's why I use Incogni. They do the dirty work for you. They go straight to these companies and they demand that they remove your personal data. Incogni even offers a custom plan, unlimited. You flag a site that's exposing your info, and Incogni's privacy team goes after it directly. So if privacy matters to you, and it should, go to incogni.com/dropdead and use the code dropdead for 60% off. Yay. Again, that's incogni.com/dropdead and use the code dropdead and start taking your data off the market today. Okay, so crisis resources. Well, we already know where that went, right? Sorry, we're busy. The 2, suicide prevention hotlines. Within days, Lindsay's messages got even more desperate. She said the Ativan had not helped her to sleep, and so she took Benadryl again, and she wrote this: "I'm desperate and really need help," end quote. And on December 12th, Ms. Gelada strongly, and I'm doing air quotes there, recommended a partial hospitalization program. All right, now we're talking, right? 3 days later, Lindsay reported that she had persistent, intrusive thoughts of suicide, and she went to Massachusetts General Hospital. She also sought treatment at Women and Infants Hospital in Rhode Island, but Lindsay was discharged. I'd like to know about that. Again, you're about to hear why all of this could make sense, but why also it could be extraordinarily aggravating when it comes to the system. It's not always simple, and you're not always a through line even the whole way. So you could present at times and then not present, and then present at times. So we're going to talk about that in a minute with Dr. Stacy Cohen. Ms. Gelada last spoke with Lindsay on December 21st, little more than a month before the killings. And she testified that despite Lindsay's severe symptoms, her thinking remained clear and linear, that she never expressed any intention to harm herself or harm her children. And Ms. Gelada testified that she never believed that Lindsay Clancy was suffering from postpartum psychosis. Psychosis is important here. Did she go all the way into psychosis? According to Ms. Gelada, no. The nurse practitioner said, "I didn't believe that." And when the prosecutor asked her that question directly on the record, "Do you believe that Lindsay Clancy was in a postpartum psychosis?" her answer was, quote, "I did not." And then, of course, comes the cross-examination, right? That's when things get tough. And the cross-examination revealed a potentially critical gap in Lindsay Clancy's care. Ms. Gelada and the other practitioner, Dr. Tufts, were treating her at the same time, right? Simultaneous treatment. And yet neither one of those two ever communicated with each other. That sounds crazy to me. You got 2 different doctors talking to someone who has persistent thoughts of suicide, begging for help. "I want to die and I don't even care." She's got 3 little kids at home. They're not talking to each other about her? Not conferring? What are your thoughts about this patient? I'm a little concerned. There's 3 kids at home. Lindsay's defense attorney, Kevin Reddington, also accused Ms. Gelada of being inaccessible while Lindsay's condition was deteriorating because Ms. Gelada was going on vacation. So that nurse practitioner, Ms. Gelada, rejected the characterization about vacation. She said that she asked Lindsay not to begin tapering her medication while she was away on vacation, but that Lindsay responded that she would contact her other psychiatrist. But again, no communication between them. Lindsay's defense attorney, Kevin Reddington, also asked whether Lindsay's husband, Patrick Clancy, had said to this nurse practitioner, quote, "You're turning her into a zombie," end quote. And that nurse practitioner, Rebecca Gelada, said she did not remember him using those exact words, but she acknowledged, quote, "I would say he was concerned." She said that she responded to those concerns by collaborating with Lindsay, the patient, and Patrick, her husband, to take Lindsay off of certain medications. And that is the central conflict running through all of this testimony. You're on the meds, you're off the meds. You're on a different one, you're on a different one, you're off a different one. You're worried about this one. The side effects are bad before they even take effect. You haven't even ramped them up to where they'll take effect, but you're moving on to it, and you're not talking to both of these clinicians together, and they're not talking to each other. And meantime, you got suicidal ideations and you had 3 kids at home. So on one side, you got a woman whose mental health was plainly deteriorating. She couldn't sleep. She felt hopeless. She was experiencing these intrusive suicide thoughts. She wrote that she felt as though she was going to die and didn't care. She cycled through roughly a dozen different meds. She sought help from multiple providers. She went to emergency rooms. She entered a psychiatric hospital. She called crisis lines and was turned away. One provider even considered whether she could even have an underlying bipolar disorder. But then, on the other side, prosecutor's side, you got 2 medical professionals who say Lindsay remained clear and logical and engaged in her own treatment. And neither one said that they observed psychosis. Neither one said they heard Lindsay describe hallucinations or voices. Neither one said they saw evidence that she had lost touch with reality. And neither one said they heard her express any desire, and this is critical, to harm Cora, Dawson, or Callan, those 3 little kids under the age of 5. So now it's that jury, right? They're going to have to make a big decision whether Lindsay's providers were the bad guys here, failing to recognize this catastrophic psychiatric crisis, or whether the psychosis Lindsay now claims she had was simply not there. That's the issue. That's the legal question here. Whether that illness prevented her from understanding that what she was doing was the difference between right and wrong, from knowing it. When she was killing those kids, strangling those little babies, Cora, Dawson, Callan, did she at that moment understand the difference between right and wrong? Was the psychosis, did it overtake her? Did she have the psychosis? Did she understand the consequences of her actions? I often explain to people that question, do you understand the consequences of your actions? It's kind of like you're holding a gun and you're waving it around and you think it's a banana. Yeah, this banana. You don't understand the consequences of these actions. You're actually waving a loaded gun. It is not a banana. But the testimony from Lindsay's medical providers is especially important when you consider what the jury has now seen from her phone. Yeah, digital evidence coming into this as well, and digital evidence is key. In the days before the killings, Lindsay searched the following terms: hallucinations, psychosis, and can you treat a sociopath? Wow. Her search history also included the term bipolar, postpartum depression, schizophrenia, insomnia, and several of the medications that she'd been prescribed. Her defense attorney, Kevin Reddington, said that the forensic report also shows that she searched for carotid artery, how to slit your throat, how to turn off an airbag in a Kia Sorento. Maybe she wanted to just drive into a brick wall. But other evidence from her phone, that paints a different picture, very different. In one note, Lindsay wrote the following, and I'm going to quote, it's pretty long. I am sad and depressed because I cannot parent my 3rd child like my first. I want to treat every one of my babies like my first, but I know that's not a feasible possibility. I am sad I stopped breastfeeding. I feel not as connected with Cal now. I think I sort of resent my other children because they prevent me from treating Cal like my first baby. And I know that's not fair to them. I know that. I was feeling so depressed last evening when Cora and Dawson came home from school. I know it runs off on them. I think she meant to say rubs off on them. So we had a pretty rough evening. I want to feel love and connection with all my kids. I'm also probably having a bit of internal conflict because my whole life I've wanted to have a lot of kids. I still don't want Cal to be our last, but I have a lot of figuring out to do before I have another. I'm on the fence about starting a new medication for anxiety, depression. I just want to feel happy. I want to be able to relax and take care of my kids. And when they go to bed at night, I want to deeply relax and hang out with Pat and then fall into a deep sleep for 8 hours, get up and pour hard into myself for an hour and a half. Cal was so very planned and desired. I want to be able to give him all the love he deserves. End quote. And then there were her final texts with Patrick on the day of the killings. They talked about their children and dinner and his trips to CVS and a restaurant to pick up takeout. At one point, Patrick texted her, "You're a good mama." And once again, the same evidence can be viewed in two completely different ways. The defense can argue Lindsay knew something was profoundly wrong and was trying to understand what was happening to her. Prosecutors can point to the suicide-related searches, the question about treating a sociopath and her ordinary messages with Patrick. They can look at that as evidence that she was able to research and plan and conceal what she intended to do. But the testimony from the people who actually treated her before the killings could go a very long way to determining that answer. So, like I promised you, to help me unpack all of this and what the terms mean and what the meds mean and what can actually happen with your mental health, how you can go into a state that nobody can see and then out of that state where everybody can see that you look normal, Dr. Stacy Cohen. Man, like I said, she specializes in this, peripartum psychiatry and women's health. And so here's my conversation with Stacy. Dr. Cohen, thank you so much for being on Drop Dead Serious.
Thank you for having me.
I want to talk about the Lindsay Clancy case in a dispassionate way. And it's really hard to do that when you're talking about the death of 3 children at the hands of their mother. That is not in question. It's whether she's insane or not at the time of those killings. And so the postpartum depression is central to this court case. And I think a lot of people still don't really understand it fully. What don't we know? This many years after Andrea Yates, what don't we still know, or what don't we still fully understand as a society?
I think people talk about postpartum depression quite often compared to how we used to. And postpartum depression can be quite common, but postpartum psychosis is one of the questions here with this case. And postpartum psychosis can be much more dangerous. Postpartum depression is what we sort of know about people in the postpartum period. When they're depressed, sometimes have trouble getting out of bed, they feel guilty, they're sad, sometimes they don't connect well with their children, they're not sleeping. And a lot of times they may not feel good, but they don't feel good about not feeling good. They know something's wrong. They're guilty a lot. Sometimes they'll even have intrusive thoughts, but those intrusive thoughts are something that we call ego dystonic. They don't like those thoughts. They're like, oh, I'm thinking about harming my baby, or what happens if I drop my baby? And they're very intrusive and they don't like those thoughts. And then postpartum psychosis, which is, what we're looking at here and what's really in question was this reality, was this person living in reality? Was a reality testing present? And reality testing is, are my thoughts telling me something different than what is real? And that's postpartum psychosis. It's much more rare, 1 or 2 in 1,000 cases. And in those cases, people can really think that they know what they're doing. They can make plans. They can think that there's something orderly and necessary and important to do that's really dangerous, and their thought process can be just wrong, and they don't realize it when it's happening. And so that's what we know less about.
Can you go from postpartum depression to postpartum psychosis in the blink of an eye without somebody seeing you right away or noticing it right away?
That's a great question. So postpartum psychosis usually happens pretty quickly in the first few weeks. I know that in this case, that this happened much later on.
Yeah, 8 months.
Yeah, so postpartum depression is usually its own diagnosis, but people who get postpartum psychosis are more people who've had bipolar or a psychosis history. And while it typically starts a few weeks after the baby's born, if it's not managed properly, for example, there's underlying bipolar or schizophrenia or a psychotic disorder that's not managed properly, then that can continue over time. So the question about can it be an overlap or can it switch? A typical postpartum depression doesn't just convert later on to a postpartum psychosis. Some depressions get so bad that there are psychotic symptoms later on because they're not managed properly, or there's added stress or a psychosis comes out. But a traditional postpartum psychosis happens right away. And then, like I said, if it's not managed properly, then the symptoms can continue over time, or the underlying bipolar or whatnot can definitely cause problems.
Is it possible? I'm trying to think of all the different ways that she might or might not have the psychosis. And if she had baby Callan, that's the last child she had, 8 months later, all three were dead. If she had baby Callan, is it possible she had that immediate postpartum psychosis, but it was really mild and maybe misdiagnosed, not noticed, and everybody just called it baby blues?
It's definitely possible that can happen. We don't always screen things properly. In fact, most pediatricians' offices, when people go with their new baby and they started to do postpartum depression checks, they're not checking for mania. They're not checking oftentimes for psychotic disorders, paranoia, hallucinations. They're typically checking for baby blues and postpartum depression. So it is possible that things get missed and don't get diagnosed because it's not part of the traditional screening process. And most primary care doctors and most pediatricians aren't really familiar with the psychotic disorders as much as they're looking for postpartum depression, which is typically their target.
What's the difference between mania and psychosis?
Yeah, great question. So mania typically comes with an elevated mood, a lot of impulsivity. People feel very on top of the world, hyper confident. They oftentimes don't sleep for many days in a row, but they feel energized. They're very productive. They get a lot done. And a lot of times they're very goal oriented and they're planning something and they're very fixated on it. They oftentimes are talking fast. They may make more erratic decisions. They may be more spiritual, more sexual, spend a lot more money. So just sort of more grandiose behaviors. Sometimes there is psychosis present with mania. Psychosis is a lack of reality testing. So people are thinking that they're hearing things that aren't really there, or maybe seeing things that aren't really there. They're maybe told things, hearing voices, hearing commands to do things. Or they think that there is maybe a TV speaking to them or giving them a message, or a higher power is giving them a message that something.
God or the devil. We hear that a lot.
And it's a fixed false belief. It's not something like, oh, I'm afraid that maybe I'm hearing this, or I don't trust myself. It's more like, oh, this is happening and I believe it. And it's sometimes very hard for a layperson or someone who doesn't know the person very well to know if they're speaking about something real or something that's sort of confabulated as part of their psychosis.
Can you have both? And I'm just wondering if you can have the mania and the psychosis, and the mania makes you look really high functioning and helps to mask that underlying psychosis.
It can happen. Yeah, it absolutely can. I mean, these things are very nuanced, and a lot of times people are seen in a primary care setting or a pediatrician's office, or maybe even in a mental health setting for short periods of time, and their behavior isn't necessarily tracked over time. I mean, obviously a skilled professional should catch these things and should really, have their eyes open and be seeing them much more, and even put them under surveillance if they're unclear. A really well-trained professional, if there's any concerns, especially when there's 3 children at home alone with an adult that has some psychiatric instability, should be making sure that there's another adult at home, and or should be really getting collateral information from family members or nannies or whoever whoever they can to really track these behaviors over time, especially when there's medication changes and whatnot, because moods can change very quickly, especially when people are under high stress. And obviously having 3 children is a stressful situation, especially if you're not mentally stable.
Well, and then there's the sleep deprivation too, which I'm sure just exacerbates anything. I mean, look, it exacerbates, well, a cold. It exacerbates everything.
Exactly.
Yeah.
I think when people are tired, there's a acronym HALT: hungry, angry, lonely, tired. All these things can add to the stress of anyone, even someone who's healthy. But when somebody has either postpartum depression or postpartum psychosis, a much bigger psychiatric emergency, any of these issues can tip things over. Go ahead. Sorry.
Oh, I'm super curious about here you and me meeting via video, right? Now I feel like I'm hearing everything you're saying and you're feeling like you know me and we don't. We're so one-dimensional. Do you have an issue with just, telemedicine to treat people like this? Because I think Lindsay Clancy had over a dozen telemed appointments with all these med changes and never an in-person and, not that other, the witnesses who could bring in a different perspective.
Yes, I think it's something we really need to be thinking about. Telemedicine exploded during COVID, and psychiatric options and therapies opened up to a lot of people, which is great, and a lot more people needed them. But a lot of professionals stopped going into the office, and a lot of people stopped going into the office. It just was not convenient, and especially for mothers, it is hard. It is hard when you're
Yeah.
taking care of multiple children and a newborn. So it's good we have more options, and you're right, it is quite one-dimensional, and things can absolutely be missed. Sometimes even just appearance. I mean, when you're Zooming with somebody in their house, they're maybe not very well groomed, but it's sort of the standard now. It's okay that they're tired, they're a mom. And when they come in, they still might not be well groomed, but you get a much bigger picture of even just the full body of, like, is there dirt on their hands? Is there, are they caring for themselves and their children? Can you see the bigger picture? You can also just see their body movements and see if they seem more erratic or if they can seem more quiet, if they're restless, if they're walking around. All those things are information that we oftentimes do miss over telehealth, unfortunately.
Like, I think it's huge, right? Because I work in a business where you get up on the stand in person for a reason. People get to make actual eye contact. They get to see whether your fingers are wiggling or your toes are tapping or your knee is bouncing because you're nervous. It's all the social cues that we've come to learn as humans about whether someone's telling the truth or not or has something else going on. Do you think this is going to be a big part of psychiatric treatment going forward, that it's great that there's more of it, but it is also dangerous to rely on it as telemedicine only?
Yeah, I mean, I think it should be. I mean, the majority of people with psychiatric illnesses, there's not necessarily an overlap with criminality. So I think it is important that we understand that, like, just because people are mentally ill, they're not necessarily at higher risk of murder.
No, but self-harm,
Self-harm, yes, absolutely, 100%. But there are a lot of criminals that don't necessarily have a psychiatric illness. And this is a very nuanced case. It's very complicated. And there are certain psychiatric emergencies that I think it is a big problem to not see the person in person because the risks are just way too high. And one of those is psychiatric instability of new mothers, period. Like, I think that new mothers that have any sort of psychiatric instability should be seen in an office. Obviously, COVID created some barriers to that, but we're not in COVID at this time. And even so, I mean, if there's postpartum psychosis, that's somebody who needs to go to the emergency room. That's not somebody who even should just be seen in an outpatient office. If they're having any sort of issues with reality testing, any sort of questions about their ability to make decisions and to be safe, they actually should not be seen in an outpatient setting. They should go to an emergency room. They should be evaluated for a residential setting. There should be somebody with those kids. And you can't really make that determination very easily over the computer.
Well,
So, yeah.
it's hard to make the determination in person as well. I mean, look, I can get a blood test. I can learn if I have cancer. I can learn if I have diabetes. But is it easy to miss that somebody may be dancing between the gray line between mania and psychosis or any other kind of depression and psychosis, as in possibly the case with Lindsay Clancy? Could she have appeared to these medical professionals who she saw and spoke with as someone who was just teetering on the edge but really wasn't a danger, but truly underneath was a bubbling cauldron?
Absolutely, she could have appeared that way. Also, if they're not trained in peripartum psychiatry, a lot of people don't really understand how high the risks are. So it's really, I mean, I have psychiatrists that will send me patients because they don't, feel equipped to work with patients who are pregnant, becoming pregnant, or postpartum, because it's just not something they're specialized in. It's a nuanced field, and not everybody has the expertise or really the understanding of just how serious these situations can be.
Peripartum meaning before you have the baby,
Yeah,
when
the
you have the
entire
baby, and
process
after.
of, yeah, before, during, after, yeah, because all of it can create psychiatric issues and changes. And which medications are safe in pregnancy is sort of part of that. But right now we're talking about the postpartum care.
So here's the other question, and I don't know the answer. I don't know if you know the answer, because I still think we're kind of finding our way as a society here with all of the kinds of postpartum illnesses. Do you have to be psychotic in order to qualify for insanity? I mean, do you have to have fallen into the postpartum psychosis in order for a jury or even a prosecutor to agree at some point, all right, I think we've got a case where this person is, well, I don't think the prosecutor's ever going to agree, but we do have a case here where we really do have, something that meets the bar of insanity.
So depression can tip someone. I guess your question is, does it have to be defined as psychosis?
Yeah.
I would say yes, but it doesn't. It can come from an untreated depression that gets so severe that psychotic symptoms occur. It can come from an untreated mania that gets so severe that psychotic symptoms occur, or it can come from a primary psychotic disorder like a schizophrenia or a postpartum psychosis, as we'll say, where the primary symptom is a problem with reality testing. But sometimes one of the mood disorders tips into psychosis because it gets so severe and it's not treated. But yes, all of those would end in, psychosis being part of an insanity plea. I mean, I'm speaking from medical, not legal.
Medical, sure.
Yeah.
Can you also come in and out and in and out of psychosis, meaning you're in a psychotic episode when you're not seeing your husband, your parents, your friends, your doctor, and then you are in a psychotic episode when you're just with those kids, and then you're out again, and everybody thinks you're fine and you're lucid and you're making your plans, but when you're by yourself and just with your thoughts, that's when the danger is.
Yeah, so these processes are not linear. It's not like someone's psychosis and they stay psychotic, and they act at this baseline for a long time. As you know from living, our moods change, our feelings change. We're more tired one day, we're in a better mood one day. And then there's also masking. When we have to perform and we have to show up, a lot of times we can hold ourselves together, especially if there are high stakes or people are concerned about us. Or even just, people go to work and they hold it together and then they fall apart when they go home. So it's absolutely part of the deal that people's moods and even stability will change based on settings. That does happen. Obviously, sometimes things are so severe that people cannot mask and they can't hold it together. I don't know if she was or wasn't. I can't comment on that. I obviously didn't see her as a patient. But I will say that it is not uncommon that people have good days, bad days. They can appear well, but they can be really doing poorly behind closed doors, which is why it's important that there's other people around in those moments behind closed doors, and also to get collateral history from people who see people consistently over time, because we just get these little information sometimes and we just miss a whole host of the story. Also, medications can change, and people can start a medication and be doing better, and then they can react poorly to that medication over time. It's very classic with traditional SSRI antidepressants. If there's an underlying unknown bipolar disorder, it can actually trigger mania, but it might not happen week 1 or week 2. It might happen week 3 or week 4. Or they can start a new medication that doesn't agree with them, and there can be a problem right away. So it's very complicated with medications, especially when there's multiple. I understand there were many medications and many changes happening.
Can a medication that's working and seemingly the panacea to everything, can it trigger a psychosis?
It could. If you're taking an antidepressant and you have an underlying bipolar disorder, it can trigger mania, and there can be psychosis as part of that mania. Absolutely.
Oof. So
Yeah.
some of these prescriptions that she was coming in and out of might actually be the guilty party?
Can happen, absolutely. Yeah. And I've had patients that like on a 5 milligram Lexapro or escitalopram is the generic name, they're fine. When they're still depressed and we go up to 10 or 15, they start to have manic symptoms. And we find out that either they have medication induced mania, which exists, or they had an underlying bipolar disorder that this medication triggered us to find out about. So it's there's so many possibilities, which is why we don't just go annually for a psychiatry visit like we might to an internist. People see their psychiatrist quite regularly, and when they're in distress, especially postpartum, they need to be seen a lot more regularly than a typical,
Yeah, because it would seem to me you need the baseline to know what you're dealing with, when there is perhaps a critical issue postpartum. I think about the medications that she was being prescribed, and a lot of them are familiar sounding and some of them aren't. One in particular, I think it was the Ativan, that's a benzo, right? Benzodiazepine? Okay, I keep thinking about benzodiazepines as being so incredibly dangerous, but they're very helpful to some. Walk me through the good and the bad and the ugly with benzos.
Yeah, great question. So, I mean, benzos are like an acute treatment for really high anxiety or distress or agitation. They work really well. We use them in the emergency room all the time when people come in right away and they're super distressed in either a panic attack or oftentimes in a psychosis, just to kind of calm them down. They work quickly and they are effective. The problem is they can cause sedation. They can cause, confusion if they're used at too high of a level. But long term, they can cause a whole host of problems. They can cause dependency. They can also cause withdrawal symptoms. And they can cloud judgment. It can be hard to drive and hard to make decisions when people are on benzos because they are sedated. So, they're one of those things that we use in an acute situation very quickly. Just like if someone came in and they broke their arm and they need a painkiller, that's the answer in the moment. Long-term painkillers are super dangerous. Withdrawal from painkillers are super dangerous. Overdoses happen from painkillers. Same thing with benzodiazepines. They're really good sedatives in an acute situation of severe distress. And long-term, they can be dangerous. They can cause addiction. They can cause withdrawal. They can cause mood instability if you're taking them up and down. And then they can also cause overdoses and driving impairments and other sorts of things.
I feel like in the mid or early 2000s, they were handing them out like candy, and we just started to realize the ills, but by now we should know better. Like, I feel like we should know better, and yet I see Lindsay Clancy's case, and I can't tell whose fault it is if you're going through a battery of meds, you're taking them in low doses, and then you're freaking out about some side effects and not waiting till you get to the actual effect and slipping into another med, and that's going on, a dozen times in a row. Is it the patient's fault? Because it seemed like Lindsay was really having, bad side effects that weren't working for her.
It is not uncommon for benzos to be used during the ramp-up period of a medication with side effects. So we sometimes get side effects from antipsychotics that require a benzo to be used during that ramp-up period. We sometimes get side effects from antidepressants. And a lot of times, unfortunately, antidepressants are called antidepressants, but they're actually also first line for anxiety. But they can cause anxiety during the first few weeks of use, and they can cause agitation. So oftentimes benzodiazepines are prescribed during that ramp-up period, but it is tricky. We don't know exactly if they're getting manic or if they're just anxious and irritable. And oftentimes it takes 4 to 6 weeks to get a patient onto the right dose of an antidepressant, for example. So it's not uncommon that benzos are still used, especially to manage psychiatric side effects early on. They should not be a long-term solution.
Yeah.
And they should not be a long-term anxiety treatment either.
Here's a real general question about Lindsay Clancy's, the evidence. I don't know everything. I know what I've seen in court. And it seems to me that she constantly had a concern that she was bringing forth to a professional, more so than any other case I've ever seen, honestly. And I've done a lot of these. I feel like this was a woman who was desperate and sinking deeper and deeper, and could not seem to get the care that she needed, clearly, to stop her from killing her 3 kids. Do you see, in general, again, according to the evidence that we've seen, this is the fault of the system, or is this the fault of a woman who was sick, just not sick enough to qualify for a defense?
Well, I think that sort of is one and the same. I think if the system issues don't exist, then we can actually understand that somebody doesn't need to be sick but not sick enough to get more care and protection. I think that if somebody is desperately asking for help over and over, the system needs to have more safeguards in place. And I do think that our systems are not well equipped for people who are struggling. I really think that's the case. I think that people come in desperation a lot, and there are not a lot of options, not a lot of resources. Also, sometimes not a lot of education about, the potential severity of these things. Also, just the standard of care is not necessarily to get a lot of collateral history and make sure that there's, extra people and extra support at home. Sometimes it's just not available. But our system actually should be equipped to figure that out. There should be a social worker available. I work at comprehensive care settings between my private practice and other treatment centers where there's social workers, there's case managers, so that if the doctor or therapist alone doesn't either have the time or resources, there's somebody whose job it is to find out all the other pieces in place, like who's taking care of those children, who's making sure there aren't safety issues going on. So I do think the systems have failed us and continue to fail us. I don't think that our systems are well equipped.
When you think of the system that failed Lindsay, and I will say the system failed her, I just hearing that she was turned away twice from a suicide prevention hotline, I'm going to ask you about that in a minute. It was just astounding to me. But how many people sound like Lindsay Clancy throughout your practice and your colleagues' practices? I mean, how many people are just like her that you could have no possible way of knowing what was going to happen? How common is her case?
I won't say that our case is super duper common, thank God. I mean, we don't hear about this happening all the time. And like I said, the psychosis piece is much more rare, 1 to 2 in 1,000, but that's still a number and it's still quite significant. People come in crisis after they have babies, and it does happen, and it does happen quite a bit. It's really about, to me, does the professional have the resources, the training, the understanding of how serious of an emergency can this be, and do the patients have the resources and support around them to make sure that these poor outcomes don't happen? And it really depends on the patient, but I see a number of people where all that's in place and they're still struggling and it's still hard, but there's not a safety issue, and it's pretty clear that there's not a safety issue. But when there is a safety issue, then that needs to be taken to a whole different level of seriousness, and all the precautions need to be put in place.
Yeah, resources in a perfect world. This woman had 3 kids under the age of 5. I mean, I had 2 kids under the age of 2 and I was underwater. I can't even imagine how anybody can get the kind of care that they need and then follow through, because moms are the last priority in everything, in eating breakfast, in getting you sleep, in going to the doctor, and so following an actual protocol, being able to go and see a doctor, all the perfect world things that we think should have happened, forget about it. It all goes out the window when you got a circus of 3 kids. Like, forget it.
And not another parent at home, from what I understand. There wasn't somebody else at home with her at most.
What about that issue of her being turned away from a suicide prevention hotline because she didn't have an actual plan in place to take her own life? Is that normal?
I have to say there are so many times where patients have suicidal thoughts without a plan or intent. It really depends on how they're presented, and it also depends on who's interviewing them and what questions they're asking, because people can feel like, I don't want to be here, I don't want to live, this is too much. And that can be a chronic symptom that goes on for a long time without necessarily a plan or an intent. So that is sort of a common psychiatric complaint for people who are experiencing severe mood symptoms, that they're thinking about suicide, or it comes up sometimes as a escape plan for some relief in their head. So it's really important that whoever's on the other side of that hotline is really well trained in the nuances of what is an actual acute suicide risk versus I'm calling because I'm having some thoughts. I'm not planning on hurting myself. And there are many very specific questions that could be asked, including was there ever an attempt before, including is there a history in the family, including are there weapons at home. There's a lot of questions to be asked, and it needs to be taken seriously every time. But a hotline's hard because those people on the other side of the hotline do not have a history or relationship with the patient. So, it's my opinion it should always be taken seriously, especially if you're calling a suicide hotline. You're calling somewhere that doesn't know you, and it's serious enough that you're making that phone call and you're asking for help.
I also want to be gracious to those hotlines because honestly, some people could possibly be abusing them. They need a friend to talk to. That's all it is. And in the meantime, someone's on hold who is about to take his or her life. So there is that balance. I'm sure that they also have to negotiate.
Yeah, I think anybody that thinks any of this is a black and white, there's a black and white answer to any of this, it doesn't understand the problem. This is a really complex, nuanced situation where people get different data points at different times and people have different feelings and thoughts and communicate them differently at different times. And it's very hard to communicate clearly what you're feeling, what you're planning, what's going on with you when your brain is essentially not working, right? It's not thinking clearly. So all of that has to be taken into account. Ideally, in an ideal world, people would have a comprehensive care team where everybody's in communication and talking to one another, and they can easily track med changes and whatnot. I mean, ideally, we could put our fingerprint and the entire medical record would be there, and we would have all the history, and we would have all the scales of how people were feeling on what days, and we'd be able to collect that data. But that is not how it works. The mental health system is very fragmented. And people are calling in moments of distress, sometimes when there's not a doctor or therapist available. So it's good we have the hotlines. But each piece of her puzzle is, a fragmented moment in time of a much bigger, more complicated history.
And there's no blood test. I mean, that's it for this jury, right? There's no blood test that can say yes or no, she had what you are required to have in order to qualify for this insanity defense. And that brings me to the other question about what you do for a living and how society views it. Have we come a long way, baby? Or are we still living in the Stone Age when they call this stuff baby blues and it's mamby-pamby and I don't want to talk about it. She killed her 3 kids, period, end of story, next case. I mean, where are we?
It's such a good question. It's like we've made so many strides in psychiatry. I started in surgery where things were so much more clear, and you see an x-ray and an MRI and you know what's there and you go in and you take it out. Maybe it's a little different than we thought, but we have a lot of answers. In psychiatry, things are so complex because there are different personality structures that may or may not actually be disease. They may just be a personality type or a personality structure, right? There's interpersonal relationship issues. There's work stressors. There's family stressors. There's roles. There's differences in how people feel spiritually about things. There's substance use. There's all sorts of sort of confounding variables that have to do with someone's mental health. And the state after having a baby is always going to be a state of flux because your hormones are changing. Mm-hmm. So we add the hormonal issue to all the other sort of outside influences, and then we go inside the brain. And like you said, we don't have like a clear blood test. We don't have a clear imaging test. We've come a long way in a sense, sort of a long way. We have something called gene site testing. We can figure out if like your genes interact well with a medication and you may be more prone to side effects. But even that, it does not predict the efficacy of the medications. And we don't have a test that tells us you have this. We have very extensive days-long neuropsych testing where you sit down with somebody one-on-one and ask a whole bunch of questions, and the family's asked a bunch of questions, and that may help get a really clear diagnosis. But that's a long, expensive, arduous process that's almost never done. The clinical standard is about an hour psychiatric evaluation in an office, with a new patient. And then oftentimes they're seen a month later. If they're postpartum, I'd hope that the postpartum specialists know to see them much more frequently than that if they're having severe symptoms. But you're right, there isn't imaging, there's not a blood test. Sometimes there's scales that, people answer questions on a scale. A lot of times people don't answer those fully accurately because they're afraid of the consequences. And a lot of times it's 10 questions and it's so not nuanced. So I think that the really sophisticated professionals that, know how to spend a lot of time asking a lot of questions, know how to really understand how to ask reality testing questions, and know how to get collateral information and have the time to do so, I think those professionals have come a really long way. Also, I'm guessing, I can't recall from the case, she probably was not working with a forensic psychiatrist during her treatment because there wouldn't have been a need for her to be. But, forensic professionals are going to come in with a whole different lens because they've gone through experiences of tragedies like this. But most professionals don't have those trainings. But yeah, I think we've come a long way. The ways we've come a long way is we have more sophisticated interventions. So we have TMS, we have ketamine treatment, we have brand new antidepressants, we have brand new antipsychotics that have less side effects. But what we don't have, which we could have pretty easily with technology and AI, is we could be monitoring people's moods by, having their Apple Watch or something do a check-in on a daily basis when they're postpartum. There's a lot of way, just like we have people checking their, for AFib on their Apple Watch on a daily basis. I know a lot of people that go into the hospital because their Apple Watch told them they're an AFib. Why aren't we doing scales with AI on our phones, on our watches on a daily basis when we have severe mental health symptoms so that we can actually track the changes? That would really help.
What would your watch possibly show? I thought it could only really monitor your heart rate.
Well, it can ask you questions every day. It could look at your sleep, right?
Yeah.
It could also look at is your activity suddenly super high and then super low? Are you laying in bed for 4 hours in the middle of the day? But also it could just ask scales. I mean, scales are really helpful. I've worked a lot in something called TMS or transcranial magnetic stimulation, where people are getting a magnetic treatment for depression on a daily basis. And so they are asked about their mood every day, and a team of professionals is tracking them every day. And you can really see, are they getting better? Are they getting worse? Did I miss something? Is there another symptom that wasn't really being accounted for in the initial evaluation? So, and that's because they're doing scales on a daily basis.
What are scales?
Just information collection. So it's like a quiz about your depression. There's something called the PHQ-9. There's different scales for different symptoms. So you could go in, for example, your technology can tell you, good morning, how did yesterday go? And it can ask you 10 questions about anxiety, depression, paranoia, psychosis, mania. And we could get that sort of data. We're not doing that yet. I think that some of the new tech companies and AI companies are looking into that.
I was just going to say, there is an app, there's a business here that would be really, really helpful. I never even thought of that, but how brilliant and how simple too.
Yeah, and this is to me you're asking about, are we still in the Stone Age with psychiatry? We need to sort of be marrying the two, just like we are in other parts of medicine by having monitoring on our bodies. We need to be monitoring our moods by answering questions on our phones, because our phones are basically attached to our bodies, and we're at their mercy at all times. Why are we not using that as a tool to communicate to our psychiatrists and our therapists how we are on a daily basis so we can track our mood over time? Because any one day is not going to give us the information we need for the 8 months in a tragedy like this. We really need more information.
I think that's the critical statement right there. Any one sliver of time, nobody should be hanging judgment on that, because this is a variable condition. And Dr. Stacy Cohen, I am so thankful for these last minutes, because there's been a lot that I've been confused about, and I'm pretty sympathetic to this after the Andrea Yates case. But this is so incredibly informative. I hope you'll come back.
I would love to. Yeah, thank you for having me. I really appreciate it.
My great thanks to Dr. Stacy Cohen. Wow, just a fountain of knowledge, and I will have her back for sure. If you or anybody you know is suffering through postpartum depression, please get help. And I have a line that you can call. It's the Postpartum Support International Helpline. The number is 1-800-944-4773. Again, 1-800-944-4773. Thank you, everybody, for listening. Thank you for watching. And remember, the truth isn't just serious, it's drop dead serious.